Thank you, Ken Kelly and Julian Oury, for supplying this beautiful four-chamber view of the heart. In this apical four-chamber, the first thing I noticed but don't want to talk about right now is that there is poor contractility. It is global. This person has structural heart disease and probably a very low ejection fraction. However, the thing to note in this clip is that there is color flow over the mitral valve, specifically looking at the left atrium area. And what we're looking for is mitral regurgitation, and what we see is a large regurgitant jet with turbulent flow coming through that mitral valve. Now, I know the C button or color button is intimidating because it's an extra button on the machine, but if you're in the cardiac mode, you can put it on color, and looking for regurgitation is pretty easy, and often it is clinically significant. In this patient, you can see that that regurgitant jet fills up almost the entire atrium. Since we are emergency physicians, we like to keep things simple. If you see just a teeny tiny little bit of regurgitant jet coming through, that is mild. If you see more than 30% of the atrium being filled with a regurgitant jet, that is severe, and everything else in between is moderate. Of note, if you were interested, you could categorize tricuspid regurg in the same way. If you wanted to look at something more clinically significant like aortic regurgitation, you can do this in a peristernal long axis or apical four-chamber, except the percentages are different. So now the outflow tract of the aorta needs to be covered by 60% of regurgitation, rather than 30% to be considered severe.